So I'd like to introduce to everybody Jackie Mahoney, who is the chair of the Adult Thematic Group. She'll probably do that better than me to explain that in a bit. Who's going to do a presentation about the upcoming changes, legal changes to adult care. And then there will be an opportunity at the end of Jackie's presentation for us all to pile in with lots of questions, and I hope we'll develop some good discussion then based on what Jackie's going to tell us. Okay, so Jackie, over to you. Whenever you're ready, please do carry on.
Okay, thanks Ross. Hi everybody. So thank you for having me this evening at your branch meeting. I am going to share a presentation, and like Ross said, I think the main aim of the presentation really is to provide information. There's a lot of stuff going around in the adult world, so I don't know how many people are adults, but I hope that, you know, working with adults, but I hope it's relevant also in the sense of just generating that curiosity around what is going on in the social work world for social workers, and being able to share that curiosity, because sometimes it can feel very abstract. So the main aim is really to just to generate some conversation and maybe, you know, just share information, and also get out there about the Adult Thematic Group, which is a group that meets on the regular basis too. There's practitioners, academics. I'm a frontline practitioner there, you know, talking about what's going on in social work for adults and responding to key policy legislative changes as they come along, and also advocating and driving forward, you know, social work as a profession, and providing some knowledge and hopefully some guidance as well. So I'll share when you do share. I don't know what's going on sort of for yourselves, in the sense of I can't see anybody. So I know there's a chat option down the side if you want to put anything in the chat. And there's also obviously the reactions where you can put your hand up. There will be opportunity at the end to talk, ask questions or make comments. But if you feel a burning urge to say something, then that's fine. Put it in the chat, or if you're absolutely desperate to say something, then stick your hand up. I'm a go with the flow type person, so we'll see how it goes. So I'll share the presentation, hopefully, and then hopefully you'll enjoy it. Okay, so this is just what we're going to talk about today, is adult social care reform and information for yourselves as BASW members. I think there's been a couple of, there was a BASW annual members survey, and there was some sort of 2,000 responses to that, and there were some challenges that were highlighted in terms of the immediate future of funding social care and also about cuts to local services. There was some people that felt that the perception of social work and social workers was quite negative. So you know, it's sort of, the information will be used to promote social work roles and contribution. What I will say off the bat is that I'm not a policy person, you know, I'm a social worker. So in terms of any details around the changes, then, you know, that will come at a later date. But I'm not your person. This is just really around information, sharing information. So the things that we were looking at and the things that are driving at the moment are things that like austerity and the impact of COVID-19, and that's sort of that's further compounded the inequalities around social care, but it's also highlighted in many ways the importance of social care in terms of the landscape and supporting people with lived experience. So, you know, it's done a few things that we need to look at going forward. Just bear with me. So this is me. My name is Jackie Mahoney, and I'm the co-chair of the BASW England BASW England Group, been a member of the group for a number of years now. And there you are, John. So I've been a member of the group for, I can't remember, to be honest, it must be at least 7 or 8 years. And I'm a social worker, so I work in frontline social work as a team manager. I am also a BASW member, and also so since 2008, qualified in 2008. So yeah, been a member of the group for some time, and then recently became the co-chair. So the aims of the session today is just to engage with yourselves as BASW members in terms of the social care reform agenda. Find out what you know, and that might be absolutely nothing at all. But obviously, even the, any information that you do know, or even if you're just coming from a perspective of, well, I've got this viewpoint about it, that's fine. I think part of it for me is to engage with BASW members and show what the group is doing. But also, it's very relevant to some of the things we're going to talk about, is very relevant to social work. So, it's going to change and form how social workers practice. So in terms of BASW being part of that that landscape and being part of change and informing change and making sure that those policies and practices, support social workers, then that's what we want to do as a group. So why now? So this is around I love the slide about Boris Johnson, but whatever your thoughts are about Boris Johnson, what he did commit to, or what he said he was going to do, was to fix the crisis in social care once and for all, and with a clear plan that we have. So, with a clear plan that we have prepared. But I think obviously COVID came along, and that really it highlighted why reform in social care is needed, but there wasn't really much that has sort of come out of that. In September 2021, plans were unveiled, and there's various different opinions about how how successful or how good they are. But there are some, plans and changes in legislation coming along. So what was announced? So there's a plan to finance adult social care through tax changes and to modernise social care system, ensure it's better integrated with health. And then so there's elements about actually modernising it, refunding, putting in new funding, and there's also an element about integration and bringing health and social care together in a more joined up way, and that would include joined up funding as well. So these are some of the things that are going on, some of the policies and that are happening at the moment, and I mean, and there's quite a lot, to be honest. So it's quite a lot of heavy going reading, which I'll be totally honest, I've not done. So you've got the Health and Care Act Levy, People at the Heart of Care, Joining Up Care for People, Places and Population, and Levelling Up Regeneration. So some of the Health and the Care Act and the Levy is around funding and changes to funding, and some of that is about how we're actually going to practice in terms of how we're going to bring social work up and how we're going to practice within social work and the social care system. And some of it is about integration, those foundations, those policies and procedures around how we're going to integrate with health. So the Health and the Care Act builds on the proposal for legislative change set out by NHS England in its long-term plan. So this looked at, and the Health and Care Bill received royal assent on the 28th of April 2022, and we were part of that, really, in terms of feeding into those any conversations around how that was going to be shaped. But in terms of sort of how it's going to be formed and what you've got how it's going to look, then this was the Health and Care Act was put in place. So the theory is to move away from marketisation of health and social care, and then deliver greater integration and partnership working, reduce bureaucracy and support better ways of working between health and social care, and to support the recovery from the pandemic. So a lot of that is around integration, integrated care systems. So the development of integrated care systems, making it a statutory requirement that they're in place and that there is integration in place, and it's sort of and how those are structured. So it's a big change. It's a change in terms of having those integrated care systems and integrated care boards formed, and how they're going to look and who's going to be on those boards, and then in terms of membership, and then how decisions are going to be made in relation to funding, in the relation to the way, you know, the structures and the structures on the ground plus higher up are going to look. So it's a very complicated. I've seen some recently, and it is very complicated in terms of how it's structured and how it's set up. But I think the main concern, the main worry would be around how that structure sort of disseminates down, and how that would impact on social work and social workers. So it contains, the Health and Care Act contains proposals about, like I say, integrated care systems, integrated care boards, quality assurance of local authorities' adult social care by CQC. So that new element of having oversight. We've not, in adult social care, in adults, we've not had that oversight in the same way that children's has had, but CQC is going to be introduced in terms of providing that oversight. Data and information gathering, so more proactive data and information gathering, and also more proactive sharing. There's the discharge to assess model, so homes not hospitals, and how that will continue. And I'm not sure how many people have experienced that or working within that system. And then the Health and Social Care Levy, which is developed further in a separate white paper. So that is around charging, and how people are going to be charged and when they're going to be charged, and the impact, in terms of that, can be a number of things, particularly in terms of numbers of social workers number of assessments that may increase by bringing in the levy, and also some of the logistical elements of setting that up, in the sense of there will be a cap on how much you can actually contribute before you actually get charged, and that all those thresholds are going to increase. So the Health and Social Care Levy. So this is around finally, announced the reform and the increase of funding for health and social care. So the figure that been put on is 36 billion over the next 3 years, and this is proposed through a national insurance rise, and as a health and social care levy. It introduces a cap on lifetime care costs and a loosening of means testing, promises of fair price for care for self-funders, and 5 million to support the workforce. So a lot of that is around those increases in terms of how much the thresholds for when you are self-funding, and also the contribution, the amount of care that you receive, how that transfers into your almost what I'd call social care account. So and when do you reach that cap where actually you can then need to make a contribution. So it's all sort of coming into force. And then you've got 5 million to support the workforce, so that's 500 million to support the workforce, so bringing in better, hopefully supporting the workforce to improve the structures in the workforce, and also to attract and retain workforce. Development in training and career pathways. So the bit in terms of, it sounds a lot of money, but actually in real terms, then it's only sort of a small proportion. And social care are only getting 5.4 billion over 3 years. So of the 30.3 billion raised by the Health and Social Care Levy, with the majority of money going to NHS. So there's still an argument, you know, around that parity and around, you know, how much is this amount of money going to make a difference and where this is going to go. And the cap on care costs have been reconfigured to be less generous to people with low and moderate incomes, because they will take longer to get up to the actual the cost cap. So if you think you've got £86,000, then people, you know, they're going to take longer, and the details of the fair price care, what is and how it will work, are not there at the moment. So I think that in terms of just adding into that, there's, you know, it's coming in at a time which is really, there's a really lot of a pressure on waiting lists and pressures in terms of assessments and having to prioritise, you know, life over limb type safeguarding situations. So there's a lot of pressure within the system at the moment. And I think that there's also a lot of pressure in terms of what impact this will have on social workers in the sense of an increased demand for assessments. So I think from the sort of a recent you know, a recent survey highlighted that there could be potentially the need for about another 4,500 social workers, you know, and to carry out Care Act assessments. And I think we've already, you know, we're already looking at vacancies of over 1,500 across the UK. So people at the heart of care. This is the white paper and sets out the 10-year vision for reform. And this, you know, seeks to put people at the heart of the centre of social care. So as it says, it's based on 3 principles, and it's everybody has choice, control and independence. Everyone has access to outstanding personalised care and support, and adult social care is fair and accessible. And I think that you know, as a group, we've had conversations and discussions around the white paper and welcome some elements of the white paper in terms of being rights-based and choice and having, you know, having control. But I think we're not quite sure how it's going to unfold in terms of recruitment and retention and career pathways for people within social care. So, you know, it's recognised that more social workers are needed, but then it's where are those, you know, how is that going to happen? How are we going to make sure that social work and social workers are recognised and valued? How are we going to encourage people to come into the profession? But more so as well, the bigger picture is how are we going to how is this going to support and encourage people to come into social care that then actually go on to be social workers? So the social care workforce, not just social workers but across the board, is desperately lacking, and there is, you know, a desperate sense of undervaluing undervaluing of the profession and social care as a whole. So it's, you know, it'd be interesting to see. We wait with anticipation where this money's going to go, because it's not quite sure. Obviously those details aren't available. So yeah, as just going on from that, so there's no plan for securing the additional staff needed, and it's estimated at just under 7,000 social workers that will be needed to deliver the additional assessments that may come through as an offshoot of the changes in the social care levy. And then there's nothing about pay, and therefore, you know, will this make a real difference in terms of recruitment? And there's nothing really on you know, and that isn't just for social workers, that's for social care as well. But particularly, you know, in this instance, social workers, there's nothing to talk about how people are going to be attracted into the profession. There's a welcome focus on personalisation and choice and control, which, you know, is always welcome. And there's no measures included that can make that a reality, despite recognition of the current approaches are not working. So, it's not dissimilar to, unfortunately, to most policies that come out. They follow the Westminster journey and down the Westminster line, but it's never really clear. How these properly clear, I don't think, in my view, how these things are actually going to work out on the ground. So just in terms of, I think, in terms of joined up working, a lot about the health and social care integration. So joined up care for people, places and populations. And I wanted this just to look at this in the sense of what does it mean, and you might not know, but there's always been a thing around integration being, there's that bit about working together, or is it assimilation? Is it, are we going to go into these settings with health professionals that we work in those settings? Some of you may work in those settings already in terms of hospital discharge or co-located teams. I worked in a specialist learning disability team, and we co-located with health colleagues. But this goes one step further in the sense of you're going to have the integrated care boards, which are going to be made up of a number of people, number of professionals at a higher level, working together to form services, to shape services, shape how things look, shape structures, and also disseminate funding. So I think it's, this is just, for me, it's just, I tried to capture some of my thoughts in the sense of what integration might mean for social workers, and what feelings you might come up when you first hear it. Certainly, like I say, there's elements of I'm very much waiting to see and hoping that it doesn't turn into assimilation rather than integration, and that we actually, and I think that's really important in terms of the profession and how we operate within these arenas. So I think, in the sense of our professional identity and in the sense of how we value ourselves as professionals, I think a lot of the time, there's that professional responsibility for me to make sure that we're sticking with our values as social workers. Recently, Margaret Young, who is also the co-chair of the Adult Thematic Group, did a article in PSW, and I don't know whether any of you have read the article, but one of the key message was that that health and social care does remain fragmented, and often, as you may know, or may have experienced, we're not good bedfellows. Sometimes we don't. Often, I think it comes down to personal, very much professional relationships, that relationship you have with a colleague or wherever they are. It comes down to that relationship-based work that makes things work. But a lot of the time, delivering joined up services doesn't necessarily work great, and they don't always align. There's always kickouts with with different systems, different eligibility criterias, and also I think that, in terms of coming together, then sometimes I think I always wonder what the motive is for that, whether it is actually to provide better outcomes for the person, or whether there's an element about, making sure, keeping an eye on purses and funding, and it all becomes very boundary led. I think also it's about that understanding and knowledge that each profession has of their particular roles and responsibilities, and understanding of their profession. So I think that we'll wait and see, as we will be doing, for how this all fits together. But I think what I wanted to I think the message that I want to get across, and obviously not knowing where you as a group come from in terms of different backgrounds and being social workers is that element of when we're going into these areas, making sure that as social workers we are putting ourselves, you know, we know what our role and responsibility is, we know where we're coming from, we remember our values, and we remember that, and we, you know, that parity with health professionals, we're always out there making sure that it's a level playing field in terms of professional opinion and viewpoints. So what are the aims? Again, I just wanted really to look at, you know, just to give some visuals in terms of what the aims are. So there's an element about pooling budgets. So you're creating new ICS boards, sharing information. So there should be a better sharing of information across health and social care. And then working together. I suppose some of the concern is again around implications for social workers. Where would our career pathways be? Where would social work values and identities sit? Will it be seen as an equal partner in these type of arenas? So you know and all the things that sort of support social workers in the sense of how things might be structured, you know, who's on the board, who's on the team, are you getting, you know, the proper support from a social work based manager, for instance, or supervisor? How are people going to work in these? There's an element about working together to achieve better outcomes, or can achieve better outcomes. Pooling budgets, you know, can have a real benefit for people because you've got possibly more money in the pot, but that's not necessarily any good if somebody else is driving where that budget goes. It's, you know, it's over managed. Information sharing, there's a lot of disjointment at the moment in terms of, you know, we have social care have a set of information, health hold a set of information. Sometimes that information is duplicated. Sometimes you're doing, you know, the same one thing to one person, the same thing to another. So I think it's, you know, there are some benefits to integration, but certainly some things that could be a cause for concern and have an impact on social workers. So this is just leveling. So leveling up is it's basically leveling up. So it's about, you know, bringing people up in terms of how they live, you know, in terms of opportunities they have, you know, what local authorities are going to be doing to make sure that their communities are you know, equal, and that they're living a good life. And so these are some of the things that obviously the government paper is looking at, in the sense of making sure that we are, as a country, you know, that, well, London isn't just the centre of the universe, that everybody has equal opportunity and everybody has, you know, the same sense of living. So this is reflection. So this is just what this means for social care. So it's the success of levelling up is dependent on all parts of the system working together, yet mention of social care is notably absent. So levelling up, so one of the things around levelling up is being part of the solution in working with most risks and the risk, you know, people with lived experience, the most marginalised people in society, and although that it has been one of the things that have been missed out, is felt that being missed out, is around social care. That it's not actually, that's not being part of the paper, the policy paper. And in terms of levelling up and having a skilled workforce, in terms of in terms of social care. So that doesn't mean, you know, people who not just social workers, but social care support staff, social care, all those people who work with people with lived experience, who have, you know, who need support, who are marginalized, disadvantaged, being able to have a whole system that gives them as much, you know, as much opportunities and the same opportunities as others. So to both, it's essentially looking at the existing inequalities and how they're going to be addressed. But again, it's not, I think one of the points and one of the concerns is that social care isn't in there as much as it should be, in terms of being part of that levelling up agenda and being and needing to be part of levelling up as a part of the system. So so these are just some of the things that we wanted to be considered by yourselves. Explore the foundations for adult social care reform and the challenges ahead. Consider the implications for social work and the people and families and communities we support. What do you see as the priorities BASW England should be focusing on in terms of a response? So just some things to consider, and hopefully during the next sort of few minutes. So yeah, any questions? So yeah, just to look at, you know, is it what question, you know, any questions that are out there, any queries, anything, whether or not it's been informative. So what we do, just to quickly before we go back to that, so what we look at is up and coming legislation, identify ways that can improve it through amendments. We keep issues we care about on the agenda. So in terms of BASW, then that's what these, you know, you as branch members can do. The thematic, you know, the thematic groups, we write reports, we respond to policy changes and departments of ministers to consider, you know, we run campaigns also just in terms of social work, and offer guidance around for social workers around these changes that could have an impact on social work as a whole. We've been involved in a lot of stuff, a lot of ongoing things in terms of select committee. We've been involved in the select committee. We've responded to the white papers as and when we've been given the opportunity. So there's a lot of work going on that BASW does, but you know, only in a branch in terms of supporting members, you know, social workers and members in branch meetings, but also with the thematic groups as well. And there's lots of thematic groups across the board, that, you know, in terms of every area really. So yeah, that's it from me. So I'll put it back to yourselves.
Okay. Ooh, I've got an echo now. I'm not quite sure what's going on here. Hey, thank you, Jackie, for that. That's been really helpful as a good start. Lots of stuff in there I didn't know, and I'm guessing a lot of other people didn't know either. Do please feel free to put your cameras back on now if you'd like to take part in the Q&A with your camera on. Keep them off if you don't want to. And as I said before, if you've got questions and you're not happy to share them openly, please do put them in the chat. And we'll see what we can go. John, you've got your hand up, so I'm guessing you're going first.
Oh, thanks very much, Ros. Yeah, Jackie, I found that really useful. I think especially for those of us where adult social care has not been necessarily part of our bread and butter, to have a really clear exposition of where we're up to. That's been really helpful. My question is, as I understand it, some places who have benefited from the government's approach to devolution in England, specifically Greater Manchester, have got a bit of a head start on this notion of integrating health and social care. Do we know if there's any early lessons from their experience that might help us across the rest of England?
Not that I'm aware of. I know that, yeah, I think that's the difficulty. I think that everybody's at different stages. I know certainly within my local authority where I work, then we're just doing the PowerPoint slides, to be honest, and then some people are further down the line. So I think that you know, it's quite difficult to get a picture. I think certainly because there's not a lot of information sharing and reports out there and feedback around how it's working. Especially, I think there's some more concern around how the membership of the ICBs are formed and who's going to be part of that, and where the power's going to be held in the sense of those funding streams going down. So there's nothing there at the moment, but I will take it back to the group in the sense of if there is something, you know, in terms of if there is something, then we can have a, you know, we can certainly have a look at that and build that in. But nothing, I don't think there's anything official at the moment, that because everybody's, like I say, they're at different stages.
Okay, thanks very much.
Okay. Any other questions for Jackie? Comments?
How many people work in adult social care? Is it a big group of adult social care, or?
Put your hand. There's 2 there. And there's another one there. I know another one there is 3. Who else works in social care? Put your hands up. Yeah, it's 3 there.
All right, okay. And is anybody working in a hospital discharge setting?
I don't work in a discharge setting, but I do a lot of liaison with discharge, and that's often a moot point for a number of the people that I support, especially because it's usually where the people that I support usually are in a hospital ward where they will need to go on for further rehabilitation. So they might need to go to a brain or a spinal unit, and there's often, as you know, beds not available, etc., 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 and they end up being discharged home to inadequate, in my view, inadequate support.
And how do people feel about when worked within in integrated settings? Have anybody worked in integrated settings? Anybody co-located with health professionals? No.
We've got one. I mean, you may not want to say anything, and that's fine, but we do. There you are. We do have somebody who works in a hospice. That's definitely a co-location.
Yeah, I mean, it's a charity, so it's not local authority, but you definitely come across that medical model and social model. And as that, I don't know who just spoke before me, but I can absolutely identify with that situation, that just discharging people home, and it's definitely not safe. Cognition wise, and my people are terminal, so it is a worry for me.
Yeah, I think when I co-located, what we found with that is that there was an element around the challenges were those who came in, so the eligibility criteria was very different. There are different ways of working, and then there's a slight power rub in terms of whose professional opinion is more, you know, in terms of navigating those conversations around professional opinions, and that can be quite challenging for social work. And as this grows, because integration will be growing, then for social workers, you know, that could be a challenge in the sense of having those interprofessional conversations and being able to recognise and stand to the values and the values of social work, and also trying to, you know, get across your professional viewpoint when you're in a very sort of powerful, you know, you can be in a very powerful medical model situation, can't you? You know, in hospital settings, they can be quite difficult settings, any type of setting. I mean, I've worked in, you know, with specialist learning disability team, worked in hospital discharge, worked with consultants, and I think, you know, that can be quite challenging for social workers. What do you, I mean, in terms of just knowing about these types of things, what is the level of knowledge or interest in these type of things? Does it all seem very abstract and out there and nothing to do with, you know, on the ground stuff? Or,
I think for me it's very abstract because I don't work in local authority. But when it first came out, actually what happened is my student forwarded to me an email and say, have you seen this? And I was like, no. And then I forwarded it to I work very closely with the CCG. I forwarded to CCG and I forwarded to my managers, and nobody knows about it. So
how have you found CHC funding then?
They don't know about it. So they just say to me, Esther, everything is still the same. You just do what you need to do. Get on with it. We need your reports. We need your assessments. Just get on with it. So, so nobody really knows how this is going to affect, I mean, the whole system. They just think, let's just go out and do as what we do it because it's working at the minute, by where I am. So, yeah.
And what do those people, I mean, in terms of just in terms of, does everybody else work within children's, under 60, under 18s? Where do you work, Kevin? Where do you work, Kevin? Are you were in social work, aren't you?
I'm a student. I'm learning.
Woohoo!
But I've got loads of big ideas because I'm an ex-business teacher, and I see so many weaknesses in against social work. That I feel that we need to equalise us to give us the benefit to help our living experience people that we support, and that's my biggest problem. Like, we can talk about this till the cows come home, but unless you get people on that funding board, nothing's going to happen. We the social workers are going to be just not listened to or cast aside. So you need people on those boards that do the funding to give it to the people, and not just give it to somebody to buy loads of something they've never used. And that's happened already loads of times. So I've got, like, because see, I can talk till the cows come home, but truthfully we need people to do stuff.
Yeah. Yeah. Anybody? And I mean, in terms of what's the feeling around, you know, coming at having CQC, for instance, come in and start to do audits and look over work, etc. Is anybody from children's where Ofsted are already going in?
From my point of view, it's just normal. It's normal with teachers. It's just standard procedure. You keep standards high, which social workers, what I'm learning, it's really high standards anyhow. You know what I mean? So there shouldn't be a problem with Ofsted if you're a keep up to date, well trained social worker. You won't have a problem. The only problem would be the people who don't keep up with things like not knowing about the government. Where's the funding? If we don't know there's this pot of money somewhere, how are we supposed to access it? We're not doing the best for our living experience customers, our people. So, and this is like, I never knew anything about this. What you've taught me tonight is brilliant, and I know about it now, but I put money on it. I bet the next social worker I speak to, I bet they might not know much about it, if at all. So it needs to be out there.
Yeah, and I think that's one of the things about, you know, getting out there and getting the message out there. You know, this is in the sense of just creating that curiosity and going, do you know about this? Because I think ultimately once the cap comes in, like the charging levy, you know, the charging cap, then potentially that could have a big impact on the amount of people that are coming in to do assessment, you know, requiring assessments, and also just in terms of a workforce being, you know, knowing that you've got the support and the skills and the knowledge to, you know, to do those, to step up to that, because it may, you know, we're not gonna there may be a significant shortage in social workers as work increases. So I think, you know, it's really important. It was really important to get it out there and to sort of just really, you know, share what we've done. Unfortunately, you're the first branch, so you're a bit of a guinea pig. So I'm hoping I'll fine tune myself, and the presentation will be fine tuned as well.
I come at it from a practice education point of view, Jackie. So I'm thinking about what this means in terms of social work training and so forth. And, you know, you're quite right talking about how we suddenly going to get all these extra people to appear. So I'm kind of thinking, have they got the idea of having some sort of fast track model brought in for adult social work in the same way as frontline and step up have been brought in for children's social work?
I think there's a start of that, isn't there, with the Think Ahead, isn't it, with mental health, where you've got sort of a model of fast track. And I think you know, there's that bit about needing to build numbers and be attractive, but I think part of the conversation is about leveling up the workforce as a whole. So if I want to be a social worker, you know, how do I do that? How do we get somebody, you know, how do we attract people into the social care workforce, who then, and what is their career path from there? And I think how this money is going to be spent is still on, you know, a bit of is unknown. But you know, and certainly there are changes afoot within the education in terms of recently, but you know, so where that's going to go, and what is, you know, bursaries and apprenticeships and all those types of things which will attract people into social care, because they know they've got a future, you've got a career path. What is the career path for those, you know, social workers who are here right now, but also the ones that want the budding social workers that are starting, you know, from a different place. So it'd be very interesting to see how all that pans out. And the danger is with some of these is that you don't actually see it physically, you know, on the ground. You don't seem to see it. It just disappears into some kind of pot somewhere. Becky, did you have had your hand up?
Yeah, I think people are experiencing, for want of a better word, fatigue. You know, I mean, we talked about personalisation over 20 years ago. You know, we've been talking about personal budgets for, you know, I mean, it feel, and I don't have any of the detail, you know, I don't, but you know, it's sort of rehash of this and of that and of this and that, and there's no kind of forward thinking, in my view, of the bigger picture. There is a massive crisis in adult social care, and we seem to be kind of passing the buck around, and I think, you know, it doesn't feel like this is going to actually, you know, in terms of the people that we support, you know, it is, if anything, it's going to make it more complicated by the potentially, you know, and we've already got those, you know, you mentioned CHC, you know, when you try, I mean, people, I mean, the thresholds for CHC are incredible. You know, I'm not a health professional, but you know, I attend those meetings and I'm sitting there thinking, hang on a minute, this is a health need. You know, I'm not a health professional, but you know.
Yeah, that's what I think. That's why I picked on that, really, because I've been in many a DST and tried to, you know, argue, so trying to put the case across for continuing healthcare. And I think for me, I think the bit is across the board. I think it's how social workers interact in those arenas. And I think some of this is, regardless of the legislation, you know, that's around there, it's actually, for me, very much as somebody who is quite passionate and determined to make sure that social workers remain a workforce, remain valued, remain respected, is making sure that social workers, you know, within those arenas, when you're talking about CHC, that you actually know, you know, and you're putting that professional viewpoint across, and are, you know, as much as and challenging where you need to challenge, because those, and that's the danger with integrating and integrating care systems and boards, is that you're going to get the same argue over a pot of money. And the people, you know what I mean, and if you haven't got proper representation on those boards, then it's gonna be very health orientated, I would suggest. And that's the concern, is where does then that go to in terms of social care and social, you know, for people with lived experience as well as ourselves, because you're going to get a lot of, you know, the money's not going to be, you're going to be still going to be having those discussions about money.
But it's about holistic assessment, isn't it? And you know, I think that's where the social work skills come in, is in terms of assessment. And if you don't have those key assessment skills in terms of the bigger picture, you know, then we miss something important, and we end up, you know, focusing on something that is the current you know, focus of the media or whoever, and then we lose sight of, you know, what the person actually, you know, is saying to us, and are we listening to the person? Because sometimes I you know, I don't think we do.
No, I think we get caught up, but we get caught up in the you know, in the local authority bit and not the social work bit. I think retaining an identity around social work does very much contradicts and rubs against the fact that we are, most social workers are working for local authority and, you know, maybe perceived as agents of the state. But we're actually, you know, so maintaining a focus on across the board, this is across the board, maintaining a focus on who we are as professionals and trying to work within those systems and navigate them and work around them. I mean, personalisation, you know, can mean, has been around for a long time. And I think it's something, you know, personal budgets, control, choice. I think sometimes for me, that's very much in social workers' gift to make that a reality. I mean, you know, recently I did an assessment for somebody, and we did an assessment and they were eligible. But actually, what he wanted to do was to get out and about in his community. He wanted to get out and about in his community, and the way he could do that was a mobility scooter. And his wife, you know, was the carer, and she was willing to do all his care. She said, I'll do everything else. You know, I said, but he's not been out for 3 years and he can't get out without a mobility scooter. I did a one-off payment for a direct payment, 1,800 quid. And that was it. That was like 35 quid a week versus, you know, and I think sometimes that time and space and permission to think creatively and think in a values rights-based approach is just not allowed within, you know, within the constraints sometimes of local authorities. And I'm saying this from a position of working within a local authority, but I'm a bit of an anarchist, and I will push back whenever I can and do things really sneaky. It was one of those moments where I was looking behind me thinking someone's going to tell me something in a minute, do you know what I mean? But the thing for me was, the biggest thing for me about that was he came to the office and he had a massive smile on his face because he was going to wheel him, because he was going to go to town to get his wife a card, because he hadn't done that in 3 or 4 years, and he was able to do that because he'd got that, and his wife will, you know, make sure he's okay. And we've just spent you know, a menial amount of money and created so much, so, you know, some good outcomes. And I think sometimes, again, within these arenas, we don't necessarily focus on what outcomes we can achieve, and we can achieve a massive amount of outcome. And sometimes we're the only person in the room that will maybe be honest and have integrity and work it all out. You know what I mean? So I think that, yeah, I think that in terms of some of this stuff, I think it is down to us as social workers when we practice on a day-to-day basis, you know, and work and make those small changes for people, push back a little bit on the system. You know, so I think that these are big things that are coming in for social work. And I know you've got changes within children's as well for anybody who's on the changes. So you've had the, you know, the review recently, and there's big changes coming in within children's, and potentially, you know, it's quite a really important time for social work in terms of, you know, putting our flag in the ground.
Mm-hmm.
Okay, that's me on my soapbox. Sorry.
No, that's we like people on the soapbox. That was really good. I'm just wondering about a couple of things that just strike me. The first one, when you mentioned the carer there in that story you've just told, and where do carers fit into this whole thing would be a question I have, really, because I didn't see any reference to it, and we know that, you know, carers are getting a raw deal most of the time, and this doesn't seem to improve things much for them.
And I think that's a bit about social care not being mentioned in levelling up in terms of things like care, you know, in terms of poverty for people, for, you know, making those difficult decisions around carers. Well, if I get a carer's allowance, I'm only getting what, 50, 60, 65 quid a week or something. In, you know, in European countries, other carers are getting, you know, much more amounts of money. And how do we value carers when they've been holding people apart, holding people together when everything else has fell apart for the last 2 years? How are we valuing them? How are we, you know, supporting them? And you know, a carer's assessment and some kind of commissioned support is not the answer for most carers, and most carers actually don't want to be called that, but they just want the opportunity to be able to, you know, look after people, but also not be in poverty because of it, because they're actually saving us millions, billions even, you know, in funding.
Absolutely.
Sorry, did you have a second point there, Rod?
Yeah, the second point that struck me, we were talking about integration of things and services. You know, we're going to hit the same bugbear we've hit all along, which is IT systems, isn't it? About the fact that we cannot integrate IT systems, and we've never been able to do anything. And look at Becky, she's actually having hysterics here. But you know, I worked in one of the first ever youth justice teams many moons ago, when all this discussion was had about integrating, you know, social work and the police and the probation department and the youth service, and we had exactly that problem there. Our IT systems never actually worked at all with each other, and I can just see how this is going to be, really.
I mean, you'd hope that the first thing that these integrated care boards would do was say, that would address the IT issue and the sharing information issue. I know recently we've done some work with integrated care teams, and it took 4 months to negotiate getting access to health records, 12 months in total to get it sort of all smoothly. So you're talking 4 months, you know, in terms of to get like access to health records and access to health systems in order to be able to have a more, you know, a data, more holistic picture in terms of data or in terms of people, and not having to say the same things twice. But yeah, we've not learnt in the sense of, you know, the safeguardings and child protection, and, you know, all about communication and, you know, sharing the benefits of sharing information in terms of having a full picture, and one organisation knowing information that another organisation doesn't know, and etc. So yeah, I think that's a massive challenge, and I don't know how it's, you know, and it could probably blow the whole 5 billion budget, really, to be honest, if you know, because getting it all into one is just, I don't know how it's going to work, really, to be fair, and whether it is, but you'd hope that was what these boards would look at in terms of information and share.
How much did they blow on the whole COVID IT systems? You know, you know, that's about where we're at, isn't it?
Yeah, because we're having the same problem with carers, in the sense of, I work, you know, within the carers, so I manage a carers team, and not, you know, we have a pool of people, and then, you know, health come into contact with carers all the time. So those hidden carers, you know, those people who interact with health and don't interact with social care, and vice versa, you know, capturing those people and being able to maybe provide a consistent and across the board level of support is just not, you know, it's just not happening, and getting hold of that information and getting people on board just isn't there, really, to be honest. So yeah, it's going to be a real challenge. But so I'll let you, so hopefully you know what I mean, like I say, that's been informative at least, and created some thought and just some curiosity really, in terms of, you know, certainly in terms of exploring what this means further, because there's lots of information out there, and there's lots of information on the BASW. If there is any more information that you want, then obviously you can get in touch with Liz, who is the professional officer for the thematic group, Liz Howard. But you know, these things are coming out all the time, and hopefully as things progress, we'll be, and we are in there, do you know what I mean? I think what I want to reassure you as well is that we are in there. We have got a voice. It might only be a tiny voice, but we've been on the, select committee. So we put up, myself and Margaret were there when the select committee was getting responses together to go back to. We've got a person in Parliament. We've done reports. We've responded to these types of issues from a social work perspective. So we are in there, you know what I mean, and just, tweeting away annoyingly, and hopefully it'll get louder. But yeah, we are in there, so at least we're not BASW social work isn't unrepresented.
Did you say you've got a Twitter account?
No, I was saying we're twittering in the background.
Tweeting. I was going to say, stick your Twitter handle in there.
Yeah, no, I haven't personally, but obviously, I think that's something we're going to work on, in the future in terms of the adult thematic group. We might be, doing a few more things like this, and doing, just getting it out there a bit more. Mm-hmm. But thank you very much for having me.
Hang on. We've got just somebody typing something. Just hang about. Oh no, she's gone again. Oh, there you are. No, so that's okay. No, okay. Well, thank you very much, Jackie. Honestly, that's been really enlightening. Really enlightening. Good. What's interesting for me is the next session we're having is we're actually talking about perinatal mental health social work, which actually will link really nicely to some of this discussion, I suspect, because obviously that's another area of social care that is relatively new and unknown, and but very, very interesting. And we're going to be looking to ask some questions about how is that going to fit in with this new setup. So thank you for that. So I've been asked if you'll please just send us the slides.
Yes, I will. I'll get them sent through.
Everybody gets them. Thank you very much. Please, everybody, can we just give Jackie a quick round of applause for doing an excellent job this evening?
Oh, thank you.